right, people, thank you very much for staying tuned to PTV World. You're definitely watching World this morning alongside Shahzad Hassan Khan and Miss Maheen Jaffrey. Earlier, ladies and gentlemen, we were talking about how the entire nation comes together to observe Yawm Tashakkur. But before heading out towards a short break, we did talk about how research is very important. And to kind of talk about that, I even said that we have a really very important day to observe, and God forbid, ladies and gentlemen, over here, people do not have this habit of visiting their doctors very regularly. And it's until that time that something cannot be done of that very problem which they were facing or coming across, and they had to rush to the hospital, and it's an emergency and it's chaotic. So today it's very important that we kind of talk about the, do you want to say that? World Oral Health Day, ladies and gentlemen, which will be on Sunday 20th of March. But since we do not have a show on Sunday, we wanted to kind of give it due attention, that too on Friday. So ladies and gentlemen, the theme this year around is Be proud of your smile. And when we talk about smile, ladies and gentlemen, that's the most beautiful curve on any human body, and we really need to kind of look after it. Because God forbid, if my smile is not okay, I think I will be a little shy to be on television. What about you, Maheen?
Yeah, you're saying the right things. You know, we don't care about teeth, and it is as important as our skin and hair, and it is so important for us to take care.
And the amount of time I'm using my teeth, munching something, eating something, I think I've overused them as well. But it's equally very important that we kind of look after our oral health, ladies and gentlemen. Because unfortunately, there are a few people who might not even know how to brush, and I was one of them till the time I started to do this show, and then these amazing doctors came onto the show and showed us how we really need to do it. So how to look after your oral health is something which we will be talking about, and in between, how research is very important for medical students is something we will be talking about. So we're very lucky that we've actually been joined by somebody who happens to be an MBBS, MPhil and PhD. She happens to be Professor Dr. Asma Irfan. Hello ma'am, assalamu alaikum, good morning.
Walaikum assalam.
Kaisi hai ma'am?
I'm okay.
Thank you very much for joining us alongside Dr. Asma Irfan. Ladies and gentlemen, we're very lucky that we've been joined by the Principal Dental College High Tech IMS, and he is Professor Dr. Irfan Shah. Assalamu alaikum sir, sange khairam barabar.
Assalamu alaikum, and thank you very much for inviting us.
Thank you very much sir for joining us. Wonderful to have you.
And the next guest that we have is Associate Professor, High Tech Dental College, Texla, and her name is Dr. Shahreen Zahid. Welcome to this program, ma'am.
Thank you so much.
Thank you very much for joining us. Too young to be an associate professor. Looks wonderful how youngsters are doing such an amazing job.
And then we have a third year BDS student, High Tech Dental College, and her name is Aima Kashif. Welcome to World This Morning.
Thank you so much. Thank you for having me.
Thank you very much for joining us. Wonderful to have you. I'm going to get started with the conversations with Dr. Irfan Shah. Obviously, first of all, I want you to raise the awareness and importance about World Oral Health Day as well, and how smile is the best curve on our human body. Let's talk about that, and then we'll come down to the associate professor and how we really need to kind of do our research. Please go on.
So thank you very much once again, and I wish I could greet this word in as many languages as you did in the morning. So 20th of March is actually celebrated as World Oral Health Day around the world.
True.
And our colleges and our institutions, including High Tech Dental College, is in the forefront of creating awareness. So we have done a number of activities, and in fact we have celebrated an entire month of oral health awareness creation, and we have run free dental treatment camps at our institutions, our hospitals, in which we have treated about 10,000 patients free of cost.
Wow.
And when we talk about such treatments, sir, what kind of treatments were there to be offered to people for free?
So like you mentioned, the awareness regarding oral health, dental health, mouth health is lacking in our societies. Many patients present with late stage dental cavities, gingival or gum diseases, bleeding gums. So these are the things that are common in our societies, and we were offering free dental treatment for all these diseases and disorders.
Wow.
So why are dental procedures so expensive? I mean, not just in Pakistan, all over the world.
Well, the misconception is there that dentistry is expensive. We have institutions where comparatively cheaper treatment options are available. We are using some of the best materials available in the world, because most of those materials are imported, expensive, the dental equipment is expensive, and because it takes a lot of time for the doctor to spend on the patient. So if a medical doctor spends, let's say, 5 or 10 minutes on a patient, we spend an hour or something like that to treat those dental diseases. So it's time, resources, equipment and material, everything is expensive. That's why dental treatment ultimately becomes expensive.
Thank you very much for saying that, sir, as well, because it was really very important that we share it with people as well. And ladies and gentlemen, what I have witnessed is that it totally depends on which clinic you're going to, so they're very modern clinics, they will have some amazing lamps, expensive lamps outside their clinic, a wonderful receptionist, and then all of a sudden that, that chair you lie down on, it's just very expensive. So, you already know that you're going to pay a lot of money. But imagine that there are hospitals, as Dr. Saab has mentioned himself as well, talking about high-tech IMS as well, talking about IMDC, where there are free camps as well, and you can go and you can just get your teeth fixed for less than 400 rupees. So it's totally about who you choose to go to, and I think everybody has the right to go to whoever he wants to or she wants to go to. But very quickly, I'm going to come down to Professor Dr. Asma over here as well. Now, I think I have mentioned it before as well, and I believe in it, that research is very important. Every single day we have to go through some vigorous research to be over here in front of our audiences as well. Ma'am, what I would want to kind of ask you is that without any research facility, how do you think that students will be able to do their research work? We have those classrooms, we have everything we need to kind of do whatever we want to do, but we do not have research facilities within universities. How do we come up with that, first of all?
Yes, this is the main problem with our students and our economic conditions of the country. Previously, HEC used to provide us with funds and financial assistance as well, and I'm also I got in 2009 when I was doing my PhD. HEC also gave me funds, and there were a lot of medical PhDs at that time.
True.
But you will see that in these days there is a lack of funding, and the PhDs, they are not available to teach other students.
True.
And this teaching process is in a lagging condition.
And which is why, I certainly wanted to ask you on a very lighter note. So if you've done MBBS already and you were a doctor, why did you do another PhD? I mean, what do people actually call you Dr. Asma now, or is it just the doctor?
No, if you see in the world, basically all the clinical side, they have to do PhD.
All right.
And PhD and research, it is part of the curriculum.
I think research is a part of PhD anyways.
No, this is part of curriculum.
Okay.
So in our society, in our conditions, most of the people, they think that research is not so good and it is a very boring subject.
All right.
But this is the basis of medicine. And you see, this is basically, research is creation of new knowledge.
True.
And someone has beautifully said that research is to see what others see, and it is to think what no one has ever thought.
Wow.
Like
So,
finding solutions
yes,
and saving patients' life, or maybe working for your society.
Yes, in Quran, Allah Pak says that when you save life of a human, it is as if you have saved entire humanity.
Exactly, wonderful.
So we are dealing with a human life. So research is the basis of all the medical fields, and it is of high value.
And I truly stand by it as well, and I have always been an advocate of research, ladies and gentlemen. It's really very important. But Dr. Saab wanted to add something?
Yeah, I totally agree with ma'am that research is an expensive commodity, but advanced level research is, yes, expensive, but basic level of research is actually not that expensive, and we at medical and dental colleges are now promoting research extremely well. So many of our students are actually indulging in research projects at their own level.
Exactly, that's wonderful. So I wanted to move on to the associate professor, a very young associate professor over here in the studios with us. My question for you is, now while you were studying and now when you're teaching, how many times have you come across that, okay, that what you learned after some research, it has now changed, and that you have to kind of teach them something which is newer to you and to your other staff members as well?
Basically, I would base my dentistry and the whole journey of reaching to this point of more than 14 years of experience. I would say that throughout these years, I have linked myself to research, and whatever I am today is because of research.
Right.
Whenever we have to treat a patient, there are situations where we have to look at the journals, and where we have to check, which treatment is best for this particular case. As the treatment modalities are changing every day, it's the technology is improving, materials are improving, even the techniques are coming. Every day you'll find a better technique. For example, when you're treating or doing surgeries, you go for open heart surgery, right? But now we have pinhole surgeries as well.
Exactly,
So
we have
same
keyhole
is-
surgeries.
Exactly.
Yes.
Same is the case with dentistry. Everything is evolving. Earlier we used to think that, you know, dentistry is painful, and people still think that. I think it is.
I think that is why
transferred through
fear is
generations.
related to, you know, visiting a dentist. Always. There's a certain kind of fear. No, we're not going, and there's a
Are
delay.
you scared though
No.
of going to a dentist?
No, I am not. I just had a checkup.
Exactly, but
So we are now creating awareness that dentistry is no more painful. Please do visit us and you will have pleasant experiences.
yes.
Only if you have a problem, just don't start visiting anyways. You know, कि यार कोई मसला नहीं, लेकिन फिर भी चलो डॉक्टर साहब कह रहे हैं चक्कर लगा
Since
लेते
you all are
Don't do that.
doctors, I needed to ask something. How important are clinical trials in like helping the research documents that you have presented? And if there's a case, are there people who are willing to volunteer for such clinical trials?
Yes, people, you are asking her.
I'm asking
Anybody
all
can
of you.
answer.
Yeah.
People are always very willing to participate. The reason is they need treatment. So there are many diseases in Pakistan which are prevalent and they need to be researched. If you see diabetes, hypertension, anemia and vitamin D deficiency. I have worked on vitamin D deficiency, and there is a very interesting thing which I would like to tell you, that our patients, we have done clinical trial and we found that vitamin D deficient patients, they had a genetic defect. There was a gene mutation in the CYP24A1, and due to this genetic defect, these patients are prone to have heart diseases. So by checking these genetic defects, we can detect those patients and we can prevent the prevalence of heart diseases in Pakistan.
And you really need to stay over here because I have another question with that, but I really want to move on to Miss Aima as well because she happens to be a third-year student. First of all, why did you pick up on dentistry, and why did you bring all of your toys to our show? Why did you do that?
So I've always been inclined towards science, but a few years back I underwent serious dental procedures,
Okay.
which gave me the answer that I needed to choose dentistry. So it made me realize that I want to be that person for my patient, what my dentist is for me.
Wow.
Oh, wow.
Yeah, and then I found high tech, my college, and then ever since that, then I've been following my dream and I've been following my aim.
And how's it going so far? Is it going great?
Yeah, it's amazing, especially this year. I've been practicing on patients. I've been, my teachers have been helping me,
Yeah.
supervising me. So
Are
it's
you
been-
pursuing research?
Not right now.
Obviously, there's a
yeah,
lot of
yeah.
burden
Because
anyways,
they said
you know.
that it's a part of curriculum, so I thought I
No,
might
it
ask.
is a part of curriculum, but they first of all really need to be doctors first and
Yeah.
then kind of do
Yeah.
their research. But yes,
For
please.
that, I would like to add one thing that, you know, she is in third year right now. She has got the tools with her to do the research.
True.
Yeah.
In first year and second year and up till third year, we give the tools through the curriculum
Yeah.
to teach them how to do research.
All right.
And once that they're capable of it, then they start the research.
All right, so now what we're going to do is I want to do it the very fun way as well, ladies and gentlemen. As I said, a lot of people, majority of the people do not know, God forbid, if their oral hygiene is on point or not. So we have, you know, as Aima has brought in a lot of toys because she's becoming a doctor and aspiring dentist as well. So we'd want her to kind of tell the rest of the world, how do we really need to brush our teeth, you know, explain why did you bring all of these, you know, let's get started with that.
Yeah, so the basic mistake that the general public makes is the way that they brush their teeth.
Can you pick it up and then show us how we really need to do it? Yeah, it's all right.
So what the general public usually does is they go for the basic horizontal scrub, which is
Okay.
basically this. I think we all practice this.
Yeah.
Having.
बहुत जल्दी अम्मी बस चाय बनाने में आ रहा हूँ.
Yeah. And in this we forget to brush the other aspects of our teeth, and we also cause a lot of damage to our gums.
Okay.
So that is something we're not supposed to do.
And what do we, okay, you know, I think that's a question for either your associate professor or doctor. What do we do with receding gums? It just happens?
So it's one thing that advancing age has some natural, anatomical or normal recession of gums. But the other thing is that if you use faulty brushing techniques, just like Aima was mentioning, so traumatic brushing is one component,
Okay.
and lack of oral hygiene and keeping your teeth not clean is another factor that exaggerates the recession with the passage of time.
All right.
So again and again, I would be emphasizing creating awareness is the key.
So there's another question.
And that's
that
what
you
we are doing. But can we just
Yeah,
complete that?
please, please.
So the correct way for you to brush your teeth is to basically keep your toothbrush at a 45.
Can you just pick it up so that the camera can see it clearly and our people can see it
So
clearly?
basically you're supposed to keep your toothbrush at a 45-degree angle, just like this. I
Yeah.
hope everyone
And
can
just go down.
what you're supposed to do is you're supposed
Ride
to
a motorbike.
kind of like this.
Something like
Because you're supposed to engage your gums as well, not just your teeth. So you're supposed to provide vibratory motions like this and then a sweeping action like this.
Alright.
So what this does is it basically removes the food or whatever you had from your gums and from in between your teeth. So you do this and then you swipe it off like
So
that.
is it manual brushes, the old school manual brushes, or the new electronic brushes? What is
You can
better?
use any brush you want. Manual brushes, I think this is the most accessible brush. So you can use this, but then again, if you can buy an electronic brush, you can go for
Why
it
not?
as well.
Yeah.
But you can do this with a manual brush as well. So you do this and then you swipe it off. And then you have to make sure that your other aspects of the teeth are also being cleaned. Like behind the back aspect of your tooth, the chewing aspect of your tooth. So basically cover all of them. And then the most important thing that I think people forget is brushing your tongue as well.
Yeah.
There is a lot of bacteria that accumulates on your tongue, so you need to make sure that you brush your tongue like this.
And for a lot of people who badmouth about other people, please make sure that you brush your tongue very regularly, all right? Because you certainly do not need to do that as well. But since, sir, we are very short on time as well, what is your vision of spreading awareness to our audiences? We're going out in 46 different countries as of now, so please go ahead, whatever you want to say.
Yeah, it is through public and public campaigns that we can create awareness. At our institutions, we have, as I mentioned, celebrated an entire month.
Yep.
We have created awareness through public, print and electronic media. We have visited schools and we have talked to 2,000 students in our vicinity how to take good care of their mouth and teeth, how to take good care of their faces, what are the preventive measures for preventing caries, and what are the preventive measures for oral cancer, which is a serious disease about which awareness is really lacking.
Exactly.
So we are employing every possible way to reach to the public, both through print and electronic media.
And Dr. Shaheen, from you, for how long can we use our toothbrush?
That's an important question.
It is?
The time duration could be 2 months,
Okay.
but you have to look at the bristles. If they're going in different directions,
Or
as
probably
they start
staying
to
back
go
in your mouth, you really need to
Exactly.
throw your brush.
And I would like to add one more thing that we're missing here, which is flossing. You asked about gums. Gum recession is taking place because, the bacterial plaque accumulates between the teeth and the gum, and the best way to clean it is through flossing.
Wow.
People floss later at the age, but, earlier life,
The better.
It's earlier the better.
Don't you
and
think it is better to give training to like young mothers so that they can, teach their
I
children?
mean, even
from
with
right-
babies, yeah, because they
babies and young mothers maybe.
lactate.
What we do is we go to schools and create this awareness, and we teach the students as well over there how to do it, and the teachers, so that it can be emphasized again and again at the school level.
Oh, that's wonderful. So towards the end, Professor Dr. Asma, we know this because of the fact that, there were people who were researching continuously and making sure that they're going to bring about a positive impact on the lives of people and give them a beautiful smile, and that's what everybody wants. Even though we do have veneers, but yes, we'll talk about that some other day. But how do you think that every individual within their own capacity can learn, which is not written in the book, and still needs to be identified by someone who actually has that mindset?
Okay. Development of research culture is important for every institute.
True.
And what I would like to tell you that Islamabad Medical and Dental College, it has very high...
Or high tech, yes.
Yes, it has very good team of researchers.
True.
And this college is superior to many other institutes in Islamabad because of development of research culture.
All right.
Many of my
So it's just the
students...
culture or the facility?
Yes, facilities
Okay.
as well, because it's highly developed. And I think that government should provide us with more funds and more technical labs for improving the research.
I think that's wonderful, ma'am. Thank you very much, everybody. Thank you very much,
Thank you
Dr.
very
Irfan
much.
Shah Sahab. Thank you very much, Professor Dr. Ms. Asma as well. Thank you very much, Associate Professor. Thank you very much, aspiring student. And inshallah, you will turn out to be a wonderful doctor the way you have exhibited. I think you're already doing wonderful job as well. People
doubt.
do take a lot of pressure off medical studies as well. Ladies and gentlemen, this is the future of Pakistan. We want to educate each and every individual. We want to share knowledge. We want to share the research which we do with our audiences in 46 different countries as well. And now it's your responsibility to take this word forward. Maheen, you want to say something?
Yes, I want to say the same. We shared a lot of important information, and we hope that you actually implement that information in your lives.
Exactly, and we are observing Yawm Tashakur today as well, so please make sure to remember us all in your prayers. Make sure that you have a heart full of gratitude. Make sure that you keep on continuously thanking Allah Almighty for all He's bestowed upon you, for all the blessings you have in your life as well. Till the next time, look after yourself. Since it's Jummah, please make sure that you remember me, Maheen, our entire team in your prayers as well. Look after yourselves. 1, 2, 3. Good morning. Thank you.